Our final speaker today is Melissa Kraemer Badtke. Melissa is the principal transportation planner and Safe Routes to School coordinator with the East Central Wisconsin Regional Planning Commission. The East Central is a 10-county planning commission, which includes Winnebago, Outagamie, and Calumet among them. Melissa oversees the Safe Routes to School program, which encourages kiddos to walk or bike to school. It works with local coalitions to implement the program. She works to integrate health into transportation planning, and she serves on the local Leader Advisory Committee for the Safe Routes to School National Partnership. Has Melissa been successful? Well, since the Safe Routes program began with 8 school districts involved, there are now 32, and I guess to the math I learned here at UW Fox Valley, that'd be a 400% increase. So I think that speaks for itself. So please welcome our 6th speaker today, Melissa Kraemer Badtke.
Well, good morning, everyone. Thank you very much for the very generous welcome and the legislators that are here today, along with our panel of speakers who have such great expertise. And, you know, I always tell my kids that I'm always learning. You know, as adults, sometimes we forget that we're always learning, and I'm jotting notes down as I'm hearing from other speakers about ways we can collaborate more, or you know, ways that we've already collaborated with Wade of the Fox Valley, Theta Care, or UW Oshkosh. So thank you again for the generous welcome. So how many of you have heard of our Regional Planning Commission? I see quite a few folks. Okay, fantastic. So I'm just going to do a very brief background on our Regional Planning Commission and what we do for this particular area. So we do serve 10 counties. 8 of those counties are member counties, which means they help provide some local funds into our organization. With those local funds, we then leverage in state and federal dollars for various programs. Those can be transportation dollars, economic development dollars, Safe Routes to School, but we really work across municipal boundaries. We work on regional programs and projects along with local programs. We have 3 metropolitan planning organizations. How many of you know what an MPO is? Okay, an MPO means that we have an area in the Fox Cities that has a population over 200,000. That means in order for us to bring in federal transportation dollars into that area, we have various requirements. We have to do a long-range transportation plan. We have to do a transportation improvement program, which lists all of the transportation projects, whether they're road projects, trail projects, Safe Routes to School projects, or transit projects that receive federal dollars into this state. We also do a congestion management study, and then we work with a variety of local municipalities and counties to talk about transportation issues and land use issues in that particular area. We also serve as an economic development district, and we just have a variety of programs that we currently work on. As was mentioned, we have 274 schools within our region. This includes a tribal school as well, and we just really work with local communities on local issues that they have or local planning projects, but then we also work across municipal boundaries and really talk about the community as a whole. So what is our mission? It's really just building relationships and working together to create a community that thrives and is economically prosperous. So what programs do we have at East Central? I've kind of mentioned a few of these already. We do community facilities, so sewer service area planning, water planning, open space recreation planning, GIS mapping. How many of you have seen some beautiful GIS, like maps? Yeah, we have a GIS department that actually does that for us and creates these gorgeous maps and does some data analysis. Safe Routes to School planning and environmental management. And today I'm going to really focus on some of the Safe Routes to School aspects and then how we've brought some of those things that we've learned into our other planning programs. So these are two images that, one's from UCLA, but these are images that I see quite often when I Google or look up some national issues regarding planning and public health. This is a really big and upcoming area about how your community is developed and what it looks like and how it may affect your individual and your community health. So when I'm talking about planning or community development, how many of you have worked with a planner or a community development director? Not too many, a couple, half maybe. Okay, so community development or planners, we work with developers, we work with local government agencies, with committees to decide where development's gonna go. When we're talking about development, we're talking about commercial development. Where is that store gonna go? Where is that next subdivision gonna go? Where is that road gonna go, and what is it gonna look like in the future? Those are things that are going to influence if you're going to be able to walk or bike to school, if you are going to be able to get to that grocery store without a car, or are you going to be able to pick up transit that's only a mile away. Those are all sorts of things that really influence community health, and we've learned a lot from this. So my biggest example is safe routes to school. In 1969, we know that 50% of students used to walk or bike to school. Today, that percentage is down to 13%. If you go past any elementary school, middle school, or high school during pickup or drop-off time, you will probably notice that there's quite a few schools that have some traffic issues going around there. And maybe if you're driving to work that time, you may actually just avoid taking that route because you don't want to get caught into that. So knowing that, how does that affect their health? Well, if any of you have kids or grandkids, you know that they don't sit very long and have a very long attention span, right? So if they bike or walk to school, they would be able to be more focused in the morning when they sit down to learn math. Or maybe they just need to get the wiggles out. So at recess, when they go on their school playground, there's a walking trail, and they can walk and run and just be able to get the wiggles out. And they're building in their physical activity when they bike to school, but they're also building it into the day, right? Which is going to create them to be healthier and have healthy habits throughout their life. But these two images really show the built environment and how it can affect your life. If you think of underserved populations within our community and they don't have a vehicle, how are they going to get to healthcare services? Are they going to make that doctor's appointment if they miss the transit bus? Or are they going to be able to say, if I just can't get there, I'm not going to make it? So those are all things that we consider and we work together on with a variety of partners. So Safe Routes to School really started back in 2007, at least for us. We started working with local school districts, communities, local law enforcement, parents, school administrators, students, and we came around a table to talk about kids and safety. How do students currently get to and from school? Typically, it's by school bus or by family vehicle. We have a couple of schools that in the Fox Valley that they only walk or bike to school and maybe have their parents drop them off every once in a while. And we're not saying that you have to walk or bike every day. What we're saying is that, try to make a conscious effort that on those days that you do have to pick up, maybe you park a couple blocks away and you walk with your child into school. Or you have a walking school bus. So Sarah has been our walking school bus coordinator for one of our schools. Her daughter's school wanted to create a walking school bus, and so Sarah was one of our drivers. She picked up students along a particular route, walked with her daughter, and she had about 20 students on there, sometimes more than that. And they did that, and it was just a great way to start your day. And that doesn't mean you have to do it every day. Maybe it's once a week, maybe it's twice a week. But how did we get public health involved? At that time, DOT had set, Department of Transportation, sorry, I'm a planner, I use a lot of acronyms sometimes, said that we need to have public health at the table. And that was our aha moment. We had Winnebago County Health at the table, and we were talking about Winneconne and their school situation, and Omro, and we're talking about their Safe Routes to School situation. And they're like, well, we're looking at putting in some more trails. How are we going to do that? I'm like, well, I can help you do that. We know how to get some of that done. And that sort of started building this partnership and collaboration between the public health departments. Now they always have a seat at our table. Local law enforcement have a seat at our table for safe routes. Fire departments have a seat at our table, because who's parking in those fire lanes? How are fire trucks going to get to a school if there's an emergency and we have lots of parents dropping off? Bus drivers, they have great perspective. But this really, Safe Routes was the start of including public health in our planning process. And we've now expanded that to bicycle pedestrian plans. We work together on community health improvement plans, complete streets policies. We've mentioned that before. We were able to bring in some national experts to talk about complete streets policies and tag teaming with Weight of the Fox Valley and other partners on that. Transit development plans. We have public health sitting at the table talking about specialized transportation and transit issues at the same time. And now we're bringing in healthcare organizations. So where are those future clinics going to be going? How are they going to get transportation access to those? And all of those takes partners. It takes partners and collaboration, and sometimes it takes lots of phone calls. Lots and lots of phone calls and sitting down. And usually when we have a Safe Routes to School meeting, what I say is I ask them to say their name, their organization, what they do, and why they're there. Why are you there? Because each of us brings a different perspective to the table. I don't know everything that goes on the side of law enforcement. I don't know everything that goes on the side of school districts. They're doing long-term expansion of their campuses to figure out their long-term planning of what that's going to look like. Well, that's important because that could influence how students are getting to or from school. But it takes a lot of communication. And a lot of times, the Regional Planning Commission staff, we connect other folks, other organizations together. Hey, did you hear that Hortonville is doing this great walking school bus? Or did you hear that Greenville is doing a walking school bus from their park? And they have 60 students on their walking school bus, and that's helping to eliminate some of that traffic over there. And they're like, well, how do they do that? I'm like, here's their phone number. Why don't you give them a call? You guys would be great to talk to each other. So a lot of times it's about collaboration. It's about communicating and figuring out those best practices. I am lucky enough to sit on a national steering committee, advisory committee for the Safe Routes to School National Partnership. I was elected into that position about 6 or 7 years ago when Deb Hubsmith, the former executive director, said, hey, we want you to be on here. We want you to represent rural school districts in your Safe Routes to School program. It was a little intimidating, I'm not gonna lie, because there were representatives from all across the country. Marin County, California, they had one of the first Safe Routes to School programs in the country. But we all learn from each other. We really talk about different issues and challenges we have, and we learn from each other. I've learned a lot from public health, I have to say. One-on-one meetings, logic models, they still might not be my favorite, but I've learned how to use them. We talk with national and state colleagues. In Michigan, they were doing a project that's very similar to our College Avenue project. And they were looking at a corridor that was very, very similar. And they said, how did you get public health in the room? And this is the Michigan DOT. And I said, well, I called a couple of people and I said, we're doing this project. Can you think of anything that might influence community health? Oh yeah, we got a couple of ideas, physical activity, trying to get out to the community partnership, health clinic out there, plus all of those jobs in the industrial area, how are folks supposed to get out there? So it's really just about communication and collaboration. Some of the projects that we've worked with, we have so many great colleagues up here on the panel. UW Oshkosh, their nursing program, one of their aggregate projects was to set up a walking school bus for us in the Menasha Area School District. So the students took on that entire project and set that up. We've worked with Leadership Fox Cities on Project Radar, which is reminding all drivers about responsibility in school zones and reminding folks to slow down. It was a tremendous partnership, and that came out of some of the work that we had done with trying to raise awareness about slowing down in school zones. We're currently working on the Plan for Health and working with Health Tide, and Jen's here, about doing a planning assessment. How are we incorporating planning and health into comprehensive planning, into our transportation planning? So if we're doing a roadway project and we're working with a local community, what questions are we raising to ensure that there's sidewalks or bike lanes or transit stops along that, and to ensure that community members can actually cross that roadway to get to the grocery store, to eat those nutritional foods, or be able to access the healthcare services if they live in a particular community. We've talked about trails and increasing physical activity. It's just a wide array, and we just continue to learn through social media, through webinars. There's 9 regional planning commissions in Wisconsin, and I outreach to them. I'm like, hey, we have this issue, this problem. How have you guys dealt with it? I have counterparts in Madison and Milwaukee. For Safe Routes to School, we've had phone calls from California, Arizona, and Washington, D.C., saying, how have you started your regional Safe Routes to School program? How have you gotten all of those folks sitting at the table? And it's been phone calls behind the scenes, a lot of phone calls. And it's been asking why they want to be at the table. You know, it has to be mutually beneficial if we're going to collaborate, and it's trying to find those key pieces of information to make sure that we are on the same page, and to make sure that when we're sitting at the table, we're all working to the better good. So in our work at the Regional Planning Commission, I understand it's very broad and it's very overview, and I'd be happy to discuss any of the work that we've done. But we have found a lot of unexpected connections with a variety of organizations and partner organizations. And while each of us brings a different perspective to the table with different priorities, we cannot do this work alone. And together we can help improve the health of our community here in the Fox Valley. Thank you.